So my name is Rick Morgan. I'm a primary care sports medicine physician at Steadman Hawkins Clinic of the Carolinas in the Greenville health system. So I grew up in a small ski town in Colorado, but attended high school in Fort Collins. I finished my undergraduate training in University of Colorado in Boulder, and I did my medical school at the University of Colorado Health Sciences in Denver. After that, I trained in family medicine at Swedish Hosptital in Seattle, Washington, and essentially stayed there in primary care in family medicine, working there for the last 8 years. I decided to pursue further training in primary care sports medicine, and was fortunate enough to match here to do my fellowship in sports medicine, which I finished last year. And then I've had the opportunity to stay on and join Steadman Hawkins to do sports medicine here in Powdersville. The primary care sports medicine is a non-operative approach to sports medicine. I think the strength of having a family medicine background is you can look at the patient in a more sort of well-rounded approach, whether it's overuse injuries, acute injuries, how it fits into what people do for their work, their family lives, their sporting lives. My sports medicine practice is out of the Medical Center of Powdersville, which is it's exciting because it's really the first clinic of this type in this area, where we have an urgent care center, MD360, through Greenville Health System, but we also have a Steadman Hawkins Clinic, as well as a physical therapy location with ProAxis Physical Therapy. So it does allow us to sort of work hand in hand with one another. Certainly the most rewarding aspect is, with the patient-doctor interaction, is helping people hopefully get to some outcome that they're looking for. I think also, a large part of medicine is working day to day with people that have similar interests, working as a team with whether it's the physical therapist, with the clinic staff, the surgeons we work with, all trying to get sort of the same goals for taking care of our patients. I think what a patient should look for in a physician, hopefully you're able to build a rapport, but both the patient and the physician. It's really the care team. You hope that you have a physician that listens to you and hears your story and understands what your motivations are, where you're coming from. In primary care sports medicine, we deal with a lot of either acute injuries, sprains, strains, concussions, those type of issues, or a lot of overuse injuries or chronic wear and tear injuries. But our primary focus is really conservative management, trying to maximize how people can function, how they can work and play without needing a surgery, whether that's injections, working with physical therapists. However, we work very closely with our surgeons if that is needed. Steadman Hawkins for me has been a really exciting place to both train and work. It's really unique, I think nationally, the amount of surgeons who are working here, the amount of primary care sports medicine people who are working here, the amount of research that goes on, and really clinically based, patient-based research that's really helping improve outcomes for folks. So for me, the volume of things we see, the variety of things we see, the ability to be involved with different types of sports, different types of patients is really unique. Another exciting thing for me as a primary care sports physician has been able to work with team sports, which is something that almost all of us do and all of us enjoy. It's also allowed me to work with professional cycling teams, and I've had the ability to travel in Western Europe and throughout the States working with the young cyclists, and so that's been a really exciting thing for me. In college, I played collegiate rugby at University of Colorado, and since then, mostly just spend my time, mountain biking, road biking, hiking, that kind of thing. I'm married. I have 2 daughters, and pretty much in our spare time we like to, go on adventures and go on trips and explore the Southeast, which has been really fun and different for us.